Good evening, everyone. My name's Kathy Harley. I'm the CEO of Nurses Specialized in Wound Ostomy Continence Canada. And I have here co-presenting with me this evening, Mr. Joel Goldenberg, and he is the president of Premier Ostomy from Montreal, Quebec. So welcome, Joel.
Thank you.
These are the objectives for this presentation. And you can see here that we're going to start off by I'll give you a little bit of background on the Kock Pouch for those of you who aren't familiar. I'm sure many of you have come in contact with them, but just so we're all on the same page. Then we're going to talk about the issue of the change in accessing Medina catheters within Canada. And then we're going to introduce you to an alternative method to be able to access Medina catheters as supported by Health Canada. And then you are going to be able to work through a sample of a form that will need to be filled out, which will allow you special access to obtaining these products for your patients. And then we'll talk a bit about how they're shipped and how they're paid for. So that's what we'll be getting through in the time that we have together. And so I'm just going to start off by talking a little bit about what a Kock pouch is. So this type of surgery was first performed in 1969 by Dr. Niels Kock in Sweden. And it's a continent pouch. It's formed from the terminal ileum. And it's done after a colectomy. And so it forms an internal reservoir, and it's constructed from tissue that's taken from the patient's small bowel. The reservoir is attached to the abdominal wall with a one-way valve made from the small bowel to prevent leakage of the contents. And to empty the reservoir, a catheter or tube, which is here, is inserted through an entrance on the abdominal wall. And so that is necessary for the patient to be able to empty this internal pouch out. And so that's a little bit about what a Kock pouch is. And now I just want to make sure that you're aware of what Medina catheters are. So this is what they look like. They come in a straight format and a bent format. It facilitates safe and effective insertion and emptying of a Kock pouch. It's 30 centimeters long. It's 1 centimeter in outer diameter, and it's made of a medical grade polyvinyl chloride, which is known as PVC, with a phthalate-free plasticizer by TEHTM. So what is TEHTM? Well, it's called tri-2-ethyl hexyl trimeltate. And what it means is that with plasticized tubing and when testing is done, there is a much lower migration rate of plastic into the blood. So it's much safer to use. The top of the catheter is rounded and it has a hole, and it's very gentle to the stoma when the catheter is inserted into the reservoir. And it can release gases and reduce pressure in a Kock bladder when emptying. The distance and size of the two holes on the catheter are designed to avoid bending of the catheter when it's inserted through the nipple in a continent ileostomy. And patients should only use the Medina catheters after being trained by an NSWAC. And this is the model number and identifier of the Medina catheter in a catalog. So you can see it's M6730 for the Medina straight and M68732 for the bend. And the manufacturer of these catheters is located in Sweden. It's a company called Jorad AB, and the managing director is Tobias Hellstrand. And in Canada, they are distributed by Premier Ostomy Center, Inc., Joel Goldenberg's company. And you'll be hearing from him in just a few moments. And so to give you just a little bit of background before I turn things over to Joel, we have a little bit of background here for you so you can see what we've been up against, particularly over the last 9 months. So we've been able to track about 500 people in Canada that have undergone this cock pouch surgery. It used to be done more frequently, but now there are many newer reconstructive and diversion models available today. They used to do it also for urinary continence, but again, it's a more outdated or out mode of surgery. The Medina catheters had been sold in Canada through a company called Torbut until 2021. And the rights to the Medina catheters were subsequently sold to Yorad, which is a company based out of Sweden. Due to a declining market and a high cost of obtaining the medical device license in Canada, Yorad decided not to apply for the necessary license through Health Canada to be able to sell these products into Canada. So Premier Ostomy applied to import these Medina catheters and possessed the required licenses, but were still refused by Health Canada. And so NSWAC and Premier Ostomy joined together, and we have actively gone after Health Canada, advocating and emphasizing the importance of access to Medina catheters for patients who are based in Canada and who are still living with a cock pouch. And so what I'm going to do now is I'm going to turn this over to Joel, and he'll give you just a little bit of background of what he has been working on and dealing with around the Medina catheters.
Okay, yeah. So, thank you, Kathy, first of all. So it's been a challenge because I did have originally I was able to, as Torbot was discontinuing them, I was able to accumulate uh, a decent amount to make sure I had a bit of stock. But then that started to wind down, and we started to approach Health Canada. I believe it was in November or December of 2023. um, After meeting with URAD, and we approached Health Canada, and I first sent my original application in, and they told me that because at that point I didn't have a Class 2 license, they couldn't approve me. So I immediately amended my MDEL, which is Medical Device Establishment License, and they approved the thing. So then we went through the application again, which was on the 9th of April. Um, and then they rejected it to me because the product was discontinued in 2021, and therefore it was not considered a shortage, and because there are no licensed devices in Canada that meet the requirement, they couldn't approve my application. Um, just so everybody knows why URAD decided not to apply for the license. They estimated the cost would be for them about 120,000 euros for them to go through all the processes and whatnot, because for some reason Health Canada was not going to accept the accreditations and the auditing techniques that the EU uses or that the FDA uses. So it was going to cost them like somewhere around 120,000 euros. And like Kathy mentioned, because it's a declining market, there was no way they could foreseeably make that money back in any reasonable time. So that's why it wasn't because they didn't want to deal with Canada. It was just because the cost of doing it was very prohibitive. So if we see this, we know that many patients who have gone through the Kock Pouch surgery are older and live on limited incomes. Um, Besides the purchase cost, patients were possibly facing significant shipping and duty fees, making them quite expensive. And I guess I should circle back here because that was one of Health Canada's answers to us, is maybe the patient should just go import them themselves from the US. But it was when we heard that, and we heard some patients that were starting to do it, it was costing them over $100 a catheter to do it because of the cost, because of the shipping cost, because of the duties involved. Um, so the other problem is that Health Canada wanted to go through a special access, and but even that Health Canada still informed customs that they would allow the Medina catheters to come in for personal use. But the problem is, in order for that to happen, the patient would have to go to the customs office themselves and clear the catheters themselves. For those of us that live in major cities or in border towns, that's not necessarily a major problem if you're mobile enough to do it. But the majority of the population does not live in border towns and therefore or close to customs offices, so that becomes almost impossible challenge for them as well. The other thing is Health Canada has received up until then a very limited amount of special applications for these catheters. That's for multiple reasons. One, the older patients were unaware of the application process. Um, but the other thing is there was a limited amount of product left in the country. And quite frankly, even most of you, the NSWACs, had no idea about this special access applications or how to fill out this forms, which we will show you how to do shortly. Um, so that describes some of those challenges. Um, so that's the thing is the existing patients are depleting the remaining stock of Medina catheters. And patients are needing to empty their pouches 2 to 3 times a day, which is leading them to reuse their catheters at a higher rate than is recommended. And again, why can't URAD ship directly to patients? Well, first of all, they're a distributor based out of Sweden. They're not really equipped to and not really interested in selling 1 or 2 or 5 catheters a time and shipping them across the country. Um, Obviously the market size is part of it. Um, Cost issues, obviously, if you're going to be shipping a package direct from Sweden over to a patient, the cost would be even more prohibitive. And then there's no in-country clinical support to assist with the patient needs if that becomes the issue. So that's where I've agreed to step in and help out with through you the NSWACs and be the go-between between the manufacturer in Sweden and you the NSWACs and the patients to make sure that we have proper support for the patients.
And when we were discussing this with Health Canada, one of the things that Health Canada said was that, well, there's no way that patients need to empty their pouches frequently because we're only getting, requests for 1 or 2 catheters and very small amounts. And so we did point out that patients are reusing the catheters, and this has become kind of common. And it's not always good for them to reuse the catheters, because sometimes we did have an NSWAC tell us that she had a patient that had reused a catheter for a long time and the catheter broke off inside the pouch. So while they aren't deemed sterile and they aren't deemed single-use medical device in Canada, we definitely know that you don't want to use them for long periods of time without changing them.
So the solution was to have the single importer and distributor for Medina catheters in Canada, which would be us, a Premier Ostomy Center. And what we could do is we're going to be able to manage the importation and the distribution of the Medina catheters, and it'll provide several advantages. First of all, this way, because I will share the information with Kathy, we will be able to accurately track the number of catheters that are being used in the country and also track the number of patients that are being used into the country. Because and what you'll see with the ordering technique, with the way we have to go through the special process and the ordering, we'll be able to create a database relatively rapidly of all the patients in Canada. The second thing is if ever there was a product recall or something like that, as the single importer, I will be able to notify everybody in a very quick and convenient manner to be able to resolve any recalls of that. So therefore, it would definitely enhance the management and safety of the Medina catheter distribution in Canada.
Right. And so when Joel and I were talking about the product recall situation, basically, if you do have an issue, you just report any issues back to Joel and he will track, and we're going to provide his contact information to you. And then he'll investigate and get the product back and safely dispose it and replace it. And then the customer service team at Premier Ostomy will be trained so that there will be a rapid response rate. So there's all kinds of advantages working with Premier Ostomy. with these catheters. And so we went back and forth with Health Canada for many months, and they kept saying, no, we are not going to support this. Patients will have to get it from the US, or they'll have to try to buy it directly from Europe. And every option we knew was not going to work. It was not going to be affordable. It was not going to be efficient, and it was going to cause a lot of stress on the patients. And so we kept looking at alternatives as to how we could bring these catheters in without having to pay this large or without URAD having to pay this large licensing fee, and without them having to sell direct into Canada. And so the first area that we came to agreement on July 18th, 2024, was a special access process. And this means that there can be what's called a batch request system, which will allow for the monthly quantity required to be specified in a form. And we're going to show that to you in just a moment. And you can apply on behalf of your patients through this process under your healthcare facility. So we'll walk you through that, that process. The special access form is part of the application process, and it has to be fully completed and emailed to Health Canada. And we have their email address, which is included, and everybody who is on the call will get a package with the information in it so that you can review it and follow up after the webinar. Premier Ostomy Center Inc. is authorized to import these Medina catheters from URAD and sell them within Canada. This is noted by Health Canada. They are aware of it. They have all the information. They have the addresses. They have the contacts of Joel and Tobias. So this is all notified within Health Canada. Health Canada will notify Premier Ostomy when they receive the form that has been submitted by an NSWAC for the batch request. And then the payment process will be managed by Premier Ostomy, and they will ship and bill to the patients directly if required. And Joel will talk about that in just a moment. And then the Medina catheters, again, will be shipped out to the patients. And so if the patient is homeless, social services will need to be involved to help facilitate the process. And we've already had one patient who was homeless, and we did have to get social services involved, and we were able to successfully get the catheters for this patient.
Kathy, if you can go back for 1 second.
Mm-hmm.
I just want to specify a couple things. First of all, for the batch request, you're allowed to do it for all your patients on one. That's what the batch request means. So if you have 5 patients, you don't have to fill out 5 forms. You can fill out 1 form for the 5 patients, but it has to be filled out every single month. So I think that is an important thing to specify. And just so everybody knows, I have successfully imported the first batch from URAD. It went very smoothly. I got the the application was sent in, and it was less than a week from when the application was sent in by the NSWAC. I got the approval letter in less than a week. I placed my order. I have stock in Canada now, and it went very smoothly at customs.
Joel touched a bit on the batch request for the multiple devices. So again, we're going to show you the form, but you can order multiple units of the same device for multiple patients. You just have to have a patient identifier by their initials, and you can put a comma in between them on the form. And the way they've set it up is that you have the option to be able to order these Medina catheters to make in case there's an anticipated emergency, whether it's the licensed medical device is not available or shipping delays could negatively impact patient outcomes. And so you will have to estimate the number of devices required for this emergency use over a 1-month period. And that makes sure that there's sufficient quantities to meet the needs of your patients. And Health Canada will exercise discretion in enforcing this restriction. And so now Joel will talk a bit about how the shipping and billing works, and then we're going to show you an example of how to fill out the form.
Okay, so it is very simple. You're gonna have to, well, not very simple, but this is how it's gonna work. You have to fill out the form. On the form is going to have your name and the healthcare facility that you work at. Whether it be a hospital or a private facility, doesn't matter. It has to be, but that's what it's going to be. I will only be able to actually bill it to you or the facility that you work at. I could ship it to anywhere. I can collect the payment from anybody, but the actual bill to name and address will have to be either you or the healthcare facility that you work at. So the easiest way to do it is you would just order the product, or on behalf of we have this thing, you would get the patient to call into the store to arrange for payment, and then once that happens, we could ship it out. So the bill, if it's in your name or the healthcare facility's name, will already show paid, that it's a zero balance. So there's nothing outstanding there for that. But that is the only way it can work. I cannot sell it to any other retailers, and I cannot bill it to any other patient. It's basically very restricted. Um, in terms of how a product recall would work, it's very simple. The same with anything else. If I get a notice of a recall issue from the manufacturer, I will then pull up my database and see who we've sold the product to over that period of time, and at that point, we would then, depending on what the recall is, we would A, obviously replace the product, and then B, either ask for it to be shipped back to us or for it to be destroyed by the patient or by you guys. Um, Clinical support, we will be there. My team will be there to handle any questions. At the start, it'll probably be me, especially in terms of the initial order process. And if you're having a hard time filling out the special access or dealing with the billing or whatnot, and then as my team gets more comfortable with it as well, and as you get more comfortable with it, my team will be fully trained and able to help you out, whether it be clinical support or in arranging payment and making sure that the shipping and that process goes well. And then obviously every province is different, and obviously and AADL is one that tops to mind in Alberta because normally all the products are covered. Um, so we're gonna have to find a way to work with the AADL, because normally the AADL only pays for products that are purchased in a brick and mortar location in Alberta, as an example, and that's not going to be possible here. I don't know if there's anybody on this call from Alberta right now, um, but we're going to have to figure out a way for moving forward to solve that issue, and also for issues for people on social assistance where the government is already paying for them, and on how to arrange for that process. Although that probably would be a little bit easier because I can't imagine Health Canada would object to me invoicing a provincial health association or government agency.
And so now we're going to take a look at the special access form, and we'll show you the actual form. Well, it's here on the slide in the right-hand side, but we'll show you the actual form in just a moment. So in section 1, you have to put your full healthcare professional information. So your name, your title, your provincial license number, the number, the street, the city, the province, the territory, postal code, phone number. If you don't have a fax, just put NA, and then you put your email. Underneath that, you have to put the health facility name or healthcare facility, address, the number and the street, city, province, territory, and postal code. If you know the date of the patient's procedure, you put it into that particular box. If you don't know the date of the procedure, just write not known. And we did have the first form that came in. They did not know the date of the procedure. And then underneath, you have to put the name of the device that you want and the device identifier. So we've provided the code names and numbers that you will require, and you'll get that in your post-webinar package. And then the quantity of each catalog or model number required, that's in a month. And then you have to put the manufacturer's name, the importer's name, all that information. Again, we're going to give you an example with all of that information filled out. You also have to add the medical rationale and an undertaking and declaration. So you're basically saying that you have explained what this catheter is to the patient, and you declare that the patient is aware of this particular device. And on this presentation, there's a QR code for the form, but again, we're going to send you one so that you can take a look at it. So I'm just going to stop sharing and I'm going to pull up the form. I did see a question that came into the chat. And if you are a regulated healthcare professional and you have a registration number, if you're an RN or LPN or RPN, you can fill out the form as long as you put your registration number and the facility that you work at in there. So I am now going to pull up the example so that you can see it. And again, we will send this to you. And I'm just pulling this up. Okay, so this is just an example. You can see the nurse was Susan Smith. This is her registration number. This is her address, city, postal code. It's really important that you fill out everything. And if you don't know, then put not known or NA. This is her healthcare facility, the procedure of the patient's surgery, the date of procedure. These are the catheters. Now she probably would only be ordering the straight catheter. So you would only put that in, but I put the codes and the names for each device available. And then the quantity that are required of each model number. So she's ordering 1,000 per month. The manufacturer's name is filled in here, the company, the managing director, the country, all of the information, phone number. He has no fax, so I just wrote none. And then Premier Ostomy Center. And this is all of the information for Premier Ostomy Center, including phone number, fax, and email. And then the medical rationale for why the patient needs these Medina catheters. So it explains what a Kock pouch is and what the catheters are essential for the emptying of the Kock pouch. So that's all written up in the medical rationale. And then under the licensed devices, provide a rationale as to why these licensed devices would not adequately meet the requirements of the patient. And this basically just says there are no other catheters like this available in Canada that will address the needs of this patient population. And then the benefits are listed here. The benefits of using these catheters to empty the Kock pouch. A statement on elimination being a basic human need. And there is a statement around no recorded side effects using these catheters in Canada and how often a patient could empty the pouch. And just a statement around the Kock pouch procedure, which needs or allows the patient to be able to empty the pouch, or they could end up with a bowel obstruction. So this is basically saying if they don't get the Medina catheters, there will be a medical emergency because the patient could end up with a bowel obstruction. And then the number you're going to order. This is the undertaking. So this basically says, I, the healthcare professional, undertake to inform the patient. And if you have only one patient, you just put one patient's initials. If you have multiple patients, you put in a comma and add other patients here. And so if you do have other patients, you will be increasing the number potentially that you order in a month. And here you're saying that you have informed the patients who are to be treated with the device of the risks and benefits associated with the use of this unlicensed medical device. You put an X here, you sign it, you date it, and then you sign and date again to say that you certify the information is correct. So there are two places that you have to sign and date on this form. And then there is an email that you send it to. So you would print this, scan it, and email it to this email address, sap.devices, mdb@hc-sc.gc.ca. There also is a fax number, but you may want to email it. We do know that emailing it works. We have not had any cases yet where they have been faxed. So this is just the example of filling out the form. And in your package, we'll also send a blank form for you to fill out. So does anybody have any questions about how to fill out the form? Are there any questions? You know, it's really just working the form through, making sure that every field is filled out. If something's left blank, they will send it back to you. But you will have all this information so that it's at your fingertips and you'll be able to fill it out quite easily. And I'm just going back to the master presentation. Okay, so moving forward, there's important contact information that you need for that form. And if you have any issues in the future, you can call Joel at 514-940-9666. Or you can email me at office@nswak.ca anytime, and I will help you navigate through the system and get you connected with Joel. And you can email Health Canada Special Access Department with the form, and they will then take the form, process it, and then they trigger it to Joel. They'll send it to Joel so he knows. And then you have the ordering codes here for the catheters, either straight or bent. So you have all the information here that you need. And so in summary, we have a special access / batch process for you to be able to obtain these Medina catheters. And you have to use this special access and batch process in order to be able to access the product. And you have to be able to fill out the form and carefully fill it out and submit it to Health Canada. Health Canada has been briefed. We have met with them, as I said, multiple times in the last meeting. They said they would make sure their staff was briefed so that when these forms come in, they'll know what it's about and they'll know the process. And once they approve it, they send it on to Joel. And then you have support from Premier Ostomy, and they will assist you with the ship to and bill to process. And the tracking and reporting, we'll be tracking the number of these forms that come in, and we're going to track it over the next year, and then we'll be meeting with Health Canada again. And we will make sure that they're aware of our findings. And then if you have any additional inquiries, you can contact office@nswak.ca, and we will make sure that you get any support that you need to be able to access these catheters. Now, the Medina catheters, just so you're aware, they come 150 in a box. Um, is there anything else about pricing or sizing that you need to know about? This is the time to ask questions because we have Joel here. Given the limitations of Medina catheters, are Kock pouch procedures still commonly performed? No, they are not. They're not commonly performed. And a lot of the patients are in their mid 50s, low to mid 50s and up. And that was our big issue, is that when the company Torba pulled them out of Canada, that the new manufacturer said there was no market opportunity in Canada, but we know there's about 500 patients at least, at minimum, who require these catheters. Now, any other questions? Let's see, another one came up.
No, it only comes in a 30 French. So it
Yeah.
is 30 French straight or 30 French bent. That's the only two options.
Yeah. I have a question for the group on the webinar, and that is, how many of you, if you could just put your hands up, how many of you are looking after patients who have had a Kock pouch procedure? Yeah, so Denise, is there anyone else? No, so it looks like we have one person online. I believe Lena Martins had been online, and I believe she has had patients with Kock pouch procedures as
Yes, she said she did.
well. Mm-hmm. Yeah. Oh, Judy has had one in the past.
Well, here's another question for everybody on the chat. Because of the new procedures and the fact that all patients now have to go through an NSWAC, and some of these patients have been using these catheters for 10, 15 years and don't have access. We're going to be looking for NSWACs we're going to be willing to have patients refer to them if they contact me or Kathy or someone and say, where can I get these catheters from? Because obviously I cannot sell them to them unless they go through an NSWAC. So we're going to be looking for volunteers basically from the nursing community to help take on these patients that don't have any NSWACs.
Right. Yep. And Marcy just said they have one patient. Right. Okay. Anybody have any last questions or comments before we wrap up? And I will make sure that we send out the package to all of you, and we'll get that sent out by tomorrow. And if you have any other questions, again, office@nswak.ca. Excellent. So Judy, they're receiving clients from Northwestern Ontario region and can see via OTN. Okay, excellent.
Thank you, Denise.
Thank you, Denise. You and Melanie are in Moncton. Excellent.
Yeah.
Okay. And we're here to support you, so please don't hesitate to reach out because you may run into a patient that has a Kock pouch. And there is a process now that they can access the catheters. So thank you again, Joel, for all your hard work on this. It's been a pleasure to work with you. And we'll keep everybody posted as things progress with the special access and batch process. Thank you.
Thank you all.